My healthcare promotion topic is hepatitis. Hepatitis is an infection and inflammation of the liver that can be caused by excessive alcohol intake, drugs, and certain medications. In most cases, however, hepatitis is often caused by a virus. Viral hepatitis has various forms of transmission and includes 5 different types: A, B, C, D, and E. Viral hepatitis is contracted due to infection with a virus that causes one of the 5 major forms and can be either acute or chronic depending on the type. As the hepatitis virus enters the bloodstream, it makes its way to the liver. It then infects the hepatocytes, which are the liver cells, and begins to multiply. This leads to the liver inflammation due to the injury and the necrosis of those hepatocytes. Before going into the clinical manifestations, I first want to take a look at each of the different types of hepatitis and how each one is transmitted. When it comes to type A hepatitis, this is transmitted primarily through the fecal-oral route. It can be spread by anal-oral route, and it is rarely transmitted parenterally. The transmission typically takes place when a person ingests contaminated food or water. This type of hepatitis is acute, and the post-exposure, like if a person knows that they've been exposed to hepatitis A, they can go get a hepatitis A immune globulin within the first 2 weeks following this exposure, and this can give them temporary passive immunity. When it comes to type B, this type can be transmitted parenterally as well, and by sexual contact with contaminated human blood, secretions, and other bodily secretions as well. This can also be transmitted at birth by an infected mother to a fetus, and if this happens, the baby should then be given the hepatitis B immune globulins within the first 12 hours of birth. As far as others that know that they've been infected by hepatitis B, they too can get that hepatitis B immune globulin within the first 24 hours of exposure. This type of hepatitis can be either acute or chronic. Hepatitis C can be transmitted parenterally. It can also be transmitted perinatally, although this is uncommon. It can also be transmitted sexually via percutaneous exposure to infected blood and plasma. IV drug use and sharing of paraphernalia that is used during the snorting of cocaine and heroin also account for approximately 60% of new cases of hepatitis C. Hepatitis C can be acute or chronic, but in most cases, the acute cases of hepatitis C turn into chronic infections. Hepatitis C is the most common cause of chronic liver disease and the most frequent indication for a liver transplant. There are also no immune globulins for this type of hepatitis, and there is also no vaccine. Hepatitis D is found only in patients that have an acute or chronic episode of hepatitis B. The mode of transmission is also the same as hepatitis B, and hepatitis D cannot occur unless someone has that hepatitis B virus. This form of hepatitis is not very common in the United States, and this type can also cause both acute and chronic infections. Type E is transmitted by the fecal-oral route, just like that hepatitis A is. It is transmitted typically when someone consumes food or water that's contaminated with feces. This is a worldwide health problem, the most common cause of acute hepatitis in the developing countries as well. Hepatitis E is only an acute infection. Hepatitis typically progresses through 3 stages. These are the prodromal stage or the pre-icteric stage, the clinical jaundice stage or the icteric stage, and the convalescent stage or the post-icteric stage. During the pre-icteric stage, a person may not even realize that they're sick. Their symptoms are often vague, and they can include being easily fatigued. They can have joint pain. They may have a loss of appetite. They could have signs of dehydration, tachycardia, depression, headache, weakness. They could also have nausea, vomiting, and a change in taste and smell. Some additional physical findings in this preicteric stage include a fever. This can be 100 to 102 degrees Fahrenheit, as well as dark urine and clay-colored stools. During the icteric stage, or the clinical jaundice stage, the symptoms are going to become more pronounced, and someone with hepatitis is going to know that something's not quite right within their body. Some of these manifestations can include abdominal pain or tenderness, jaundice, obviously, which is the yellowing of the skin and the sclera in the eyes. There could be some itching, as well as anorexia and some indigestion. Some other physical findings would be rashes or hives on the skin, an enlarged and tender liver, splenomegaly, and dark urine and pale-colored stools. When it comes to the post-icteric stage, this is when things are finally getting back to normal. Symptoms are subsiding and decreasing. The jaundice starts to go away, and the liver starts to decrease in its size. With suspected viral hepatitis, routine hepatitis profile identifies antibodies specific to the causative virus. This establishes the type of hepatitis. So with hepatitis A, you're going to test for the A antibodies. You can also detect the immune globulin M. This indicates the presence of a current infection, whereas detection of the IgG means that they've recovered from the virus. For hepatitis B, you're going to test for the core antibodies. The presence of hepatitis B surface antigens and hepatitis B antibodies confirm the diagnosis. For hepatitis C, the serologic assays detect antibodies in hepatitis C. And for type D, the assays detect IgM and IgG antibodies to hepatitis D, although these aren't routinely performed. For hepatitis E, the antibody test detects the IgM and IgG antibodies to hepatitis E antigens in the serum and stool. Additional findings can be found by conducting a CMP, which is a lab test that tests the liver function. Whenever you're looking at a patient with hepatitis, certain levels within the CMP are going to be elevated. The ALT will be elevated, as well as the AST. The bilirubin will also be elevated, and the ammonia level will be elevated as well. When it comes to diagnostic procedures for hepatitis, a liver biopsy can be done to show chronic hepatitis, and transient elastography can be done. This measures the stiffness of the liver to determine the severity of fibrosis and cirrhosis. I went over some of the complications of hepatitis earlier when I was talking about the different stages of the progression of the disease, but the complications of hepatitis are numerous. Some of the complications are specific to specific types, like for instance, chronic active hepatitis only occurs in hepatitis B, C, and D, and primary liver cancer only occurs in hepatitis B and C. But in general, hepatitis can cause dehydration, hypokalemia, liver fibrosis and failure, cirrhosis, liver cancer, portal hypertension, and hepatic encephalopathy. For the human flourishing part of this assignment, I chose to focus on the nurse's responsibility to teach the patient and their caregiver the prevention measures that can be taken to help prevent the disease. With viral hepatitis, it's very important that these measures are taught to prevent this disease from spreading. While doing research for this project, the number one prevention technique that I encountered time and time again is hand hygiene. Frequent, proper hand washing is so important in preventing the spread of the disease, especially in the hepatitis A and hepatitis E, where it's typically that oral fecal route, the contaminated food and contaminated water that is making this person sick. Other practices include avoiding contact with bodily fluids and secretions that may be infected with the virus. safe sexual practices, abstaining from alcohol and certain over-the-counter medications, and getting adequate rest and eating a proper diet are also important. For a patient with hepatitis, a diet that is low in fat and high in carbs is important. The low fat due to the fact that the liver, the gallbladder isn't really able to digest those fats like it's supposed to, and then the high carb for the energy that the patient will be needing. Avoiding untreated water and unclean food, especially when traveling, is also very important. It's also important to promote disease prevention, and this happens by informing patients and their families that they can prevent both hepatitis A and hepatitis B by receiving the vaccines for both of these. They currently have the vaccine that can help the patient from getting either form to ever begin with, and to save them a lot of heartache down the road.